China is experiencing its worst COVID outbreak in 2 years. More than 5,000 cases on the mainland in just the past 24 hours alone. Now, that doesn't seem like much for a country of 1.4 billion people. But remember, this is in a country with a zero COVID approach to containing the virus, an approach that till recently seemed to have been working. Just look at these numbers. Now, on the 1st of January, the country recorded 191 cases. A month later, that number had dropped to 63. And by now, mid-March, it spiked to more than 5,000 and rising. That has meant more and more people under various forms of lockdown and COVID restrictions. One estimate puts it at nearly 30 million people across at least 13 cities in China. Some of those include the capital Beijing, Shenzhen and Shanghai. Also Jilin in the northeast. It's the worst hit across the country with more than 3,000 total cases so far.
Long queues flag the streets of Jilin as residents are mass tested for COVID-19. Nearly 90% of mainland China's cases have been reported here. And temporary hospitals have popped up to reduce the load on medical facilities. Jilin's roughly 24 million residents cannot leave the province. The restrictions are in place to battle the Omicron variant, spreading quickly in spite of China's zero-COVID policy. To the south, in Shanghai, food supply has become a concern. More and more residents have been ordered into quarantine, and the city is stocking up on extra food and running deliveries. There's no other way. We definitely have to do what the government has arranged. Is there any other better way to solve it? Omicron is highly transmissible. I have friends who I hung out with a few days ago, but were suddenly quarantined recently. I think the Shanghai government does so to protect citizens. In the long run, it's good. Our school now only has online classes, but we couldn't go back home to our hometown. Meanwhile, the industrial city of Shenzhen has fully closed down public transport, driven by a flare of cases among factory workers. Some people in China are frustrated with tight restrictions forming a noose again, especially as the rest of the world is opening up and learning to live with COVID-19. One resident in Beijing put it this way: I can't understand what's happening in other cities. The control measures were doing pretty well before, and now it starts again. When will it ever end?
Joining us now for more from Beijing is correspondent Fabian Kretschmer. Fabian, what is the COVID situation in Beijing?
Yeah, the capital is not as strongly affected as many other cities in China, but the situation became noticeably more tense. There are basically two big changes. One is that the queues in front of the testing stations became much longer. One of those testing stations you can see in the back, they just stopped operating for today. And the second big change is that the number of residential compounds that have been put under lockdown is also increasing. And those lockdowns within the city mean that residential compounds are sealed off. There's no going out anymore, at least for 1 week, often 2 weeks. And then during those time, there are many rounds of PCR tests. However, that being said, during most parts of the city, life goes on as normal. Restaurants are open, even bars are open. So it's really a very interesting situation right now.
Fabian, this is a city that's really been at the heart of China's zero-COVID strategy, that of immediately locking down areas and testing people to contain the virus, as you were mentioning. Do people still believe this strategy is working?
Yeah, in general, I mean, the number of rules are relatively high in Beijing. For example, international flights have been diverted already for a long time. They can only land in neighbor cities. And also, if you enter Beijing from within the country, you always need a negative PCR test, etc. That has led to a relatively safe situation. And people here in Beijing are relatively confident of the zero-COVID strategy. Why? Because in many cases in the past, it has worked. There have been already Omicron Omicron infections clusters, and they could be contained. Also, the recent Winter Olympics here in Beijing, they were held under a very tight, closed loop management, and none of the imported cases from outside, I mean, among coaches and also athletes, spilled over to the rest of the population. However, now we have a very unique situation. The number of daily infections have never been as high, and the number of areas that have been affected has never been as high. I mean, there are more than 60 cities that have reported cases today, so it's really a very crucial moment for China.
On a national level, Fabian, are people getting tired? Are people getting fed up?
Well, I mean, one shift in public mood that was really noticeable is that the fear of getting stuck under a lockdown is at least as high as the fear of getting infected. And I mean, there have been several discussions whether we should, relax the zero COVID regime. But the opening up of the debate recently was put back and pushed back recently. So now what the government here is looking at is also the case of Hong Kong. I mean, there the situation got really out of control. The case fatality rate is higher than even than comparable what has happened in the UK before the vaccination rate went up. So it's really a horrifying example. And so right now the relaxation will not happen before 2023. That's a consent among experts. Also because in autumn there will be a very crucial party congress happening. And so probably we will have to stick to with zero COVID.
Fabian Kretschmer in Beijing, thank you very much for that update. And here's a quick look at some other developments around the COVID pandemic in China. A team of Chinese medical workers has arrived in Hong Kong from the mainland to help with the city's fight against COVID-19. A spike in cases in Hong Kong has put its health infrastructure under pressure. Hong Kong has also been following Beijing's zero COVID approach to controlling the pandemic. Airports in China's commercial hub Shanghai cancelled more than 800 flights on Monday due to the city's COVID-19 outbreak. Bus services out of Shanghai have also been suspended. City officials have sealed off select neighborhoods and asked residents to avoid unnecessary travel. And a Chinese official has said the sudden increase in COVID cases will likely impact local economic growth. The National Bureau of Statistics, however, said on a national level, economic recovery would remain stable. Retail sales and industrial production for January and February have been higher than the same period last year. But let's try and get an overview now of the COVID situation across China. For that, I'm joined by epidemiologist Ben Cowling from the School of Public Health at the University of Hong Kong. Professor Cowling, what explains this sudden spurt in cases on the Chinese mainland?
I think in the past year, we've seen a number of times the virus has found its way into mainland China and caused outbreaks. There was a larger one in Xi'an some months ago. Right now, there's a large outbreak in Jilin province, and separately, there's also a number of outbreaks in the south of the country, in Guangdong province neighboring Hong Kong. I think we know that the virus will find its way in sooner or later, so I'm not surprised that there are outbreaks, but the current number of cases is a concern because we know once the numbers of cases get larger and larger, it's actually more and more difficult to stop the spread and get back to zero. So there's going to be a lot of disruption, unfortunately, particularly in Jilin province.
I do want to talk to you about the zero COVID approach that China is taking, but I'd just like to clarify if this is all because of the Omicron variant, or are we talking about a sub-variant of Omicron here?
It's Omicron in Jilin province and also in Guangdong province. I'm not sure if which of the sub-variants it is in Jilin province. In Guangdong, I think it would be BA2. That's the same strain as in Hong Kong right now. And it's highly transmissible. We know Omicron is very difficult to stop. It spreads very fast, transmits to a lot of people in a short space of time, and it will pose a major challenge to get back to zero. But at the same time, if you look at the entirety of mainland China, these outbreaks are still geographically very concentrated. And that's still an advantage for the zero COVID approach, that most of the country is still very much normal. It's only these few affected areas that are having their lockdowns and the disruption with the restrictions that if it goes to plan, then the restrictions won't be in place for too long. the case numbers would get back down to zero. It's going to be difficult, though.
Would you overall assess, though, that this zero COVID approach is working and therefore it is worth continuing, or is it a time for a rethink?
Certainly for the previous 18 months, I think it's been the right thing to do. As vaccine coverage was low and then building up to a higher level, it makes a lot of sense to keep the virus out. Now, though, vaccine coverage is at a higher and higher level. And so I think it is a good time to think about how much longer it's worth pursuing the zero COVID strategy for. It's been a good strategy in the past, but looking to the future, sooner or later, it will be time to relax the policies, to exit from zero COVID. Maybe not today, but we have to plan ahead. Maybe in 3 months or time or 6 months time, the process for relaxing the public health measures would have to start. And right now in Hong Kong, we have a serious epidemic going on. We've seen the issue with low vaccination coverage in elderly. I think in mainland China, they also have in some provinces relatively lower vaccine uptake in elderly. So any plan to exit from zero COVID and to relax the public health measures would have to have, as part of that, a plan to get the vaccine coverage in elderly as high as possible.
Right. We'll leave it there for the time being, but thank you so much for joining us today, Professor Ben Cowling from the University of Hong Kong. Thank you so much.